My name is Mawuena Agbonyitor. I'm a consultant psychiatrist with Partners in Health in Sierra Leone. And the mental health work that Partners in Health does in Sierra Leone is around two different things. One is that we support Sierra Leone Psychiatric Teaching Hospital in Freetown, which is a standalone psychiatric hospital. And two is that we support a primary care clinic and the mental health clinic in the district hospital in Kono District. So some of the challenges that the team has faced in supporting our homeless patients during the pandemic include one, restriction of movement of the team. As part of its national response to the pandemic, the government of Sierra Leone has occasionally instituted lockdowns, which makes it very hard for our team members to be able to reach the homeless patients. Another challenge is one that is longstanding, but worsened during these times, and that is access to shelter for our patients. Third is access to food. Due to the impact of the pandemic, there are issues around supply chain of food, and access to food is worse than usual at this time for many people, including our homeless patients. And lastly is access to medications. Again, due to impact on the supply chain, restriction of movement, it could be harder than usual for our patients to be able to get the medications they need, whether that means for them coming to the clinic or the team being able to access them to deliver medications. Some of the activities that Partners in Health is doing to address these challenges include, one, we have identified caregivers in the community for all of our patients, so that even during lockdowns, there's someone who can check on our patients to make sure that they are still able to receive food, that they're taking their medications as prescribed, and just to make sure that they're okay during those times. Two, we've adapted the way that our community health workers contact our patients to make sure that they can stay safe and our patients can stay safe. So we're following the recommended guidelines of maintaining social distance whenever we can, washing hands before and after each encounter, providing a mask to patients who are symptomatic and encouraging them to seek medical treatment. Another thing that PIH is doing is we are funding shelter for all individuals who wish to have it. So our CHWs have identified places in the communities where our patients can rent out rooms or homes for them to stay. Some recommendations I have during these times is to remember to advocate for vulnerable populations. A lot of times their needs can be forgotten, and so it's important to serve as a voice for them to make sure that their needs are addressed. Another recommendation I have is to be mindful of taking care of yourself and your colleagues. It's important to remember that self-care is important so that you're able to continue to provide care for others. And during this time, it's always nice to know that you're able to rely on your colleagues and they can rely on you so that you all can get through these challenging times together as a team.